Is it on? Yes, so thank you, Karthik. Thank you, DVR sir and team Ortho1 for their kind invitation. So I'm going to talk on something extremely controversial at this point of time in reverse shoulder arthroplasty, that is whether to repair the subscapularis or not post doing an RSA. Now this talk is going to be pretty much more of a concept, and what I'm trying to do here is to understand what's happening with the subscapularis after a reverse shoulder depending on the design. So that's what we are trying to understand here. So we all know that the subscapularis is the largest rotator cuff muscle. Primarily it has been taught to us that it works as a prime internal rotator. But what we don't know is that this is a biphasic muscle, meaning it has two components to it. And if you were to look at the subscapularis, it all depends on where your summation vector is. So if you look at the center of rotation of movement, and if the summation vector is above the center of rotation, it is going to act as an abductor. Now conversely, if your summation vector is inferior to the center of rotation, it is going to act as an adductor. So what happens if you look at the subscapularis is that if you would look at a normal subscapularis with the center of rotation, you can divide it into an upper 2/3, which is an abductor in higher ranges of movement, and the lower 1/3, which is an adductor in the initial range of movement. So effectively, if you were to look at biomechanical study, and this is Hansen's work, where what is shown is that the initial arc of movement, it is the lower fibers which are recruited. And as you go further up beyond the 80-degree mark, that is when your upper fibers are recruited. So what is the clinical impression is that in the initial range of motion, because if your lower fibers are recruited, you are going to have a more opposing force to the deltoid because of the adductor action. So intact subscapularis will cause the deltoid to work much more, that is less than 80 degrees, and intact subscapularis will also cause the transverse couples, that means your posterior cuff, to work much more to get an external rotation. And this has been proven well in literature that these changes do take place biomechanically as well. What about the not repairing the subscapularis? Now if you're not going to repair subscapularis, we all know that there is a high associated rate of instability. So that again drops us into a catch-22 situation on which way are we going to go. Let us understand the importance of subscapularis in a total shoulder. We would all agree that it's mandatory to repair a subscap post total shoulder to counterforce the horizontal force couples. That means to balance the horizontal force couples. But what happens in a reverse shoulder is that you are